triple-negative breast cancer, unlike melanoma or lung cancers or renal cancers, if you will, is certainly lagging behind when it comes to getting an approval for immunotherapy. But finally, we have some exciting data that we heard at ESMO this past year that have now been published in the New England Journal by Peter Schmidt and colleagues from the phase 3 randomized Impassion 130 trial, which evaluated the role of first-line therapy for patients with metastatic disease who've not had any other treatment for their disease. And they would either get standard of care nab-paclitaxel or were randomized to receive the treatment of atezolizumab in combination with nab-paclitaxel. And the primary endpoint for this was actually progression-free survival in both the intent to treat and the PD-L1 positive subgroup. And overall survival was also planned with hierarchical testing for overall survival for intent to treat and if positive for the PD-L1 positive subgroup. And what we saw was exciting hazard ratios of 0.8 supporting the role of atezolizumab and the combination of atezolizumab with nab-paclitaxel both in the intent to treat and the PD-L1 positive subgroups. And while we saw a very clinically meaningful, personally that's what I think about that data, of overall survival in the PD-L1 positive group, statistical significance could not be claimed due to the hierarchical testing in that group. Having said that, a 25-month median overall survival in the first-line setting is rather unprecedented and not trivial for this difficult and rather aggressive subtype of breast cancer. So I think we are excited about these data.